3-month update after my aortic valve replacement surgery, as well as the ascending aorta being replaced. This is actually take two. I just did this whole video and something didn't record, so this is maybe better than the other ones because I've had a chance to ramble for a little while. So I'll try to be very concise here. But again, this is the 3-month and 1-week update since I've actually had my my surgery back on July 14th of this year's October 21st today. So that's the time frame that we're working on. Just wanted to give an update on recovery and a few other things. I'll start with kind of recapping everything. At 18 years old, I went in for a school physical, and the nurse actually heard a murmur. From that point, I was diagnosed at the cardiologist with a bicuspid aortic valve. And for the next 21 years, I was watched every year with an echo. I was taking blood pressure medicine to keep my pressures down to hopefully make that last a little bit longer. But I was told very early on, probably by the time you're 40, you'll have to have this replaced. And so at 39 years old this year, I had my yearly echo, and my cardiologist said, hey, you're severe leakage now, and the aortic root is showing 5.1 centimeters. So met with a surgeon in May, and then in July I actually had it replaced. The ascending aorta was actually at 4.7 centimeters, but still needed to be replaced because that's far too big, and replaced my valve as well with an onyx, and here I am 3 months later. So that's the recap. You can go back and watch some of the other videos if you want to see some of that. Again, they're not great videos, but they hopefully give you some insight to what's been going on with me. I'll start with a couple of the questions I get, because these are the big things that happen, especially around mechanical valve. First is the sound. You can hear my valve ticking. I kind of joke with people that I got the loud version, but it is a pretty obvious tick when you're listening. If I'm quiet now, you may be able to hear it, but my HVAC system's running, so you may not. So I'll try that. Lean forward. And you may not have been able to hear it, but I do have a video. It's a very nice sounding click, so it's not like a watch, so that's great. Most of the time, I don't even pay attention and don't even really hear it at all. My wife is that way as well. If you want to hear it, you can kind of tune in to hear it. There's different ways I sit that would be more pronounced. My kids still hear it. I think their ears are just attuned to it, and so they can hear me from a different room. But at this point, it's become kind of fun and a joke. But that's the ticking. I've had a few friends that for the first time they've been around me in a quiet space will ask me, "Is that your watch?" And I have to explain, "No, that's what my valve sounds like." And the first question is always, will it always sound like that? My answer is always, I hope so, because that just means it's working. So again, the sound could be a fear with some people, and I know there are people that may not be able to take it, but it doesn't bother me at all. Really, the only time I hear it and it may be an issue is if I lay on my stomach to try to sleep. And I think that's just because of the way that the sound is traveling through, like the pillow or something like that. I don't really know, but if I lay on my back or on my side, I don't pay attention. I mean, I can hear it if I want to, but it doesn't bother me at all. And to that end, before the surgery, when I would lay on my stomach, I can hear my heart like pounding in my ears. Is the best way to describe it. I thought, again, thinking that was normal, but now it's actually a quieter thing. But that's the sound. At this point, it is what it is, and it doesn't really bother me. But it is, you can hear it in a room with me. So that's something to keep in mind. But again, it doesn't bother me at all. The next piece is blood thinners and being on warfarin. Since I do have a mechanical valve, I will be on warfarin and monitoring my INR for the rest of my life, which is a downside to it, but that's the trade-off that by having the mechanical valve that should last many years. Currently, my INR this past week was checked at 1.9, which I'm still in that 2 to 3 range, and I'll eventually get back to that 1.8. It's kind of where the target is with the Onyx. So that'll start shifting down now as I've passed 3 months. That was the first check I had in a month. And prior to that, I was going every 2 weeks, and then weekly at the very beginning. That has not been an issue for me at all. I can hit that on the way into town if I'm running errands, prick my finger, check my blood, talk to me for a minute. If I need to change my dose, to change my dose. So at this point, I'm on 12.5 milligrams per day. That's where it's hit for me to be right. And really, the only thing I think about is if I make a big change in my diet, then I'll tell my nurse so that way she can, if she wants to check it more often, because there are things that do affect it. But I've eaten completely the same thing I normally have. I eat all the green vegetables I want, um, you know, across the board. I drink cranberry juice. I do everything that's high in vitamin K. I do that at the normal rate I always have, and the medicine has kind of caught up with me. So I did start taking a new probiotic a couple weeks ago. So my nurse wants to check me next week too. So that's why I'm doing a 2 week check this time. But otherwise, I'm at a month between checks, and so it hasn't been an issue. Um, bleeding wise, I've cut my knuckles and things like that a few times. It may bleed a little bit more than it used to, but I throw a band-aid on it and I'm fine. So that hasn't been an issue. I have had one bruise. I bumped into a gate and had a big bruise on my thigh for about 2 weeks. And that is different because I didn't have those before. I usually just didn't bruise at all. But obviously a side effect of having the warfarin. But no, it hasn't been a big deal for me, and it hasn't changed the way I've lived otherwise. I mean, obviously, I'm still kind of in the recovery phase. But those are the two things that kind of pop up. Um, and I get questions about, so I wanted to address both of those. The other thing, as kind of in the recap, I'd mentioned, I think on the last video, that I was wearing the Holter monitor because I had noticed a little bit of an irregular beat. That seems to have completely gone away. I don't have the results back from that yet, and I'll touch on that toward the end. But the rhythm sounds completely fine now. I'm monitored at my cardiac rehab 3 times a week, and nothing out of the ordinary is showing up there as well. So I'm very thankful that seems to have just been one of those normal things as your heart tries to figure out what this new rhythm is. So that's kind of the recap on that piece. I've got a list of things, so I'm gonna try to work through these in some sort of order. I mentioned sleep a while ago. The sound doesn't bother me with sleep, and my sleep has been normal and good for the past month and a half. So very thankful for that. No issues. Really back to the pre-levels of sleep at night. Now during the day, I'm nowhere near as tired, so I don't take naps. Before the surgery, I was taking an hour, maybe 2 hour nap almost daily. And now I may catch a 20-minute nap if it's been a very busy day, or if anything like that. But that's been very rare. I can probably count on one hand how many naps I've taken. The other another thing with the scar, I do have my 8-inch scar that has healed up nicely, and you can see the top of it there. Again, to me, it's a neat battle wound and a scar to tell a story. The one interesting thing is I noticed the other day when somebody asked me that I can feel some of the wires that are holding my breastplate together. It took me 3 months to realize I could actually feel that with my finger, which doesn't affect anything besides just being another one of those cool party tricks, I guess, to tell people, hey, feel this. but again, that has been great. No pain at all in any of that area. So I think the big part of what this update is still around rehab, exercise, and how I'm feeling. So I'll reiterate again. I feel great. Like I'll at this far out, 3 months out, I feel normal. I feel like I never had the surgery, except for I have more energy. So I feel the positives. I don't feel any negatives. I feel the same way I did before. And there are days it's kind of shocking to remember that what I kind of went through. But I'll hopefully fill some of that in as we talk. So rehab, been going to rehab still 3 days a week. The nurse that's running the program it basically has been given free reign to create this program at our local hospital, which has been great. So 3 days a week, it's 30 minutes of cardio, with spot checks on blood pressure throughout, as well as the monitor looking at the rhythm. So I either walk on a treadmill or ride the little bike with the hand pedals as well, and do that. And then the last half of rehab is either strength training, upper body, lower body with bands or balance or any of that kind of thing. And then there's one day of education where we talk about diet or exercise or all the different things and cold weather and how that can affect you if you have a heart issue. And so it's been really good. I've enjoyed it. The nurses are very careful to watch you to make sure they're asking lots of questions so they understand how to help you get better the right way and slowly build your strength. And so early on I was kind of frustrated with how slow that is, but I've grown to appreciate the care they're taking there. One of the things that's come off that has actually been just learning. I've had to relearn how to fuel my body for exercise. Prior to this surgery, I wouldn't eat breakfast. I'd get up, I'd do a workout sometime in the morning or run, a fasted workout, and didn't bother me. I'd eat lunch, eat dinner, and I was good. But one of the things they noticed is my heart rate was kind of slow to respond and come down, and so we started addressing eating breakfast or having a protein drink before I came in. And basically what we found is I needed to have that protein drink about 10 minutes before I come in, because that seems to have the best effect on me. But then I've started eating breakfast once I get home from rehab as well. So that's been great, because we're looking at trying to figure out what is the best way for me to live going forward and take care of my body. So I've appreciated that. So that's been great. That's what that rehab looks like. I'm still capped in there as far as how I'm doing my exercises at around 155 beats per minute max on my heart rate, and that's like a 75-80% of what my max heart rate could be, will be eventually again. And that's just again to maintain and monitor and work up slowly to make sure that there's no hiccups. So I do appreciate that with what the rehab's been. Blood pressure has been up a little bit lately, so there's an opportunity I'll talk about maybe toward the end when I talk about the cardiologist, that I may jump back on one of my blood pressure medicines. But we've worked on some things with diet and it doesn't seem to be really responding, and it's just on the verge of being high. So just out of abundance of caution is what we want to look at that. So I think really the other piece of this is the rest of the activity and energy levels. And I mean, I have so much more energy now, so much more energy that when I do exercise or work out, I get a boost afterwards, which is, I think, normal. What everyone gets is that endorphin release and feeling that. And I didn't have that before and didn't realize it. So much I used to be able to work out and take a nap. Now I work out and I'm exploding with energy, and so that's a great thing to see, because that's a very concrete way for me to see how well this is going now. But in saying that, I have to make sure I don't do too much. So for example, typically when I do my rehab, it's 30 minutes of cardio, 20 minutes or so of strength. On the way home, I'll stop at the park and walk or do an interval run for 30 minutes, where if I'm running, I'll run until I get to 150 beats per minute on my heart rate, and then I'll walk until it gets back down to 120, and then just keep doing that run. Or I'll do a longer run where I just do a slow enough pace to keep my heart rate between 140 and 150. So I'll do that for 30 minutes, which usually gets me about 3 miles, 2.5, 3 miles of exercise there. And again, that's on the way home from rehab. Come home and eat a little bit. I've also started doing some strength training at home with body weight resistance bands, 45-minute types of things, and some yoga as well. which has given me the confidence now to do a plank or even to try some push-ups. And those, again, the mental block of knowing what happened to my chest, it's been fine. This week I'll probably be incorporating more strength training, and so I'll have to see how that goes, because I know I'll have soreness in my chest if I do more push-ups or any kind of chest work. So again, that's something I'll have to pay attention to. But then on days I don't have rehab, usually I'll go to the park and do an hour. So I'll get 5 miles of running and walking in, and that's a pretty normal thing. And so one day in the last couple of weeks, I did that kind of rehab, went for a run, got home, still felt great. After lunch, I was like, I still got so much energy, so I went and did a 45-minute strength workout. And I'll tell you, the next day I did feel that. I did overdo it, and again, the good part of that is I had the energy to do it. Then I just have to remember now not to overdo it. So that's one thing I'm learning. Another thing with fueling my body and paying attention to that is my blood sugar actually matters. If I don't fuel myself enough now, I had one little episode when I was doing a run 3 or 4 weeks ago, where I felt like I was getting a little bit of tunnel vision, and I didn't quite know what was going on. It scared me a little bit, but I sat down and it went right away, so didn't really think much about it. Mentioned it to my nurses, and they said, hey, pay attention to how you're eating and when you're eating, and that's really when that started, before I exercise and what I just mentioned. So I've been doing that, and it seems to be pretty good. I haven't had any issues up until this past Sunday, where I had a long morning. So I woke up early, had my protein drink, and then went and was at my church for several hours, because we had just a lot going on that day. Came home, had to quickly grab my son and take him to baseball practice, and I grabbed just a Hot Pocket for lunch. So I had a protein drink, which is just protein powder and water, and a Hot Pocket in the first 8 hours I was awake. And my wife and I went for a walk during the baseball practice, and right about 3 miles in, I felt everything getting dark and just getting dizzy, and thought I was going to pass out, which really, it scared me, because I thought in my head, like, this is probably blood sugar. But it scared me because, what I've just gone through, and if you've been through this as well, that this is a big surgery and a lot going on, and I can't see what's inside of me, and so it freaked me out. But after talking to my wife, she's like, yes, I definitely think it's blood sugar. So I had a friend come pick us up, went to the store, grabbed some food, got a quick, bunch of sugar, as well as some carbs to kind of level me out. It took about 30 minutes to really settle me back down where I felt fine. I was worn out the rest of the day and tired the next couple of days, so I took it easy exercising. So that was earlier this week. But after talking to my nurses and really looking at it 100% was blood sugar. I did not eat enough, so I've got to pay attention to that more now, because in talking to the nurses and cardiologists, it could be related to a few different things. It could just be that my body's still kind of in shock and doesn't know what to do after the trauma of the surgery. It could be now that my heart is pumping proficiently and my muscles are getting the right blood flow and oxygen level, that I'm metabolizing it faster, and so that could be it. It could just be a fluke. I don't think there's really a concrete thing to look at, but again, I know that now, that I need to pay more attention to it. And so that was a scare, and it's, to be clear, it wasn't with my heart, with my valve, or any of that, and so I think that's that's a good thing, but it did obviously scare me, make me think a lot about that. But again, that was just because I didn't eat and I overdid it, and hopefully I learned my lesson there and won't have to come back and say it happened again. But yeah, so exercise wise, like I feel like I could do anything. I feel normal. It's after 5 p.m. right now, and honestly, I feel like I can go out and run today after I've already went for a 4-mile walk today, and this and that and the other. And so the energy level and stuff is amazing, and I feel great at 3 months. I keep saying that, but it's because it's true, and hopefully it's encouraging if you're watching this on any side of this surgery. One thing around activity level, I do wear a watch, and so an activity watch, and it tracks steps. And for the last 75 or 76 days now, I've been over 10,000 steps a day, and that's between walks and runs and all the other activities I'm doing, and really averaging closer to 15 or 16,000 steps a day, which is more than I was doing before, and I think that's a good change. And I was in good shape before, very active, but having the consistency of doing it every day, because we all get those days where you're at work or something, and you're kind of stuck at your desk and you don't get a chance to move around, and I feel so much better when I do. But to have 76 days of a streak of over 10,000 steps, I'm very happy, and again, that's been through recovery, and so it should continue on as long as I make the time to do it, because the energy level is there and everything like that. The other two big things, and one of the reasons I waited for this week, was this past Wednesday. I had an echocardiogram. It's the first one since surgery. I mean, obviously I had the TEE during surgery, so I knew everything was buttoned up and done well and right, but I can't see inside. I know that all the doctors and the nurses and all the stuff I've been talking about has looked normal and good, so I knew everything was good, but I still wanted to see it, so I had that echo. And I asked a lot of questions, and the tech that did the echo was great. She showed me a lot of different things and made sure I could see the valve and made sure I could see this and that. And then she also pulled up a comparison between my echo from March of this year, so what basically triggered to say, hey, go have the surgery, and this. And so I snapped a picture. Probably wasn't supposed to, but I did. But this is the comparison. So if you're familiar with an echo, you kind of know what you're looking at. But this is what the echo looked like this Wednesday. This one was from March, and so you can see this Wednesday, this blue is all the blood in my heart that's not going the wrong way, we'll say. So as it pumped, you can see all this turbulence, and red was the leak coming through that aortic valve right here every time my heart pumped out, and you can see that is gone. There's a trace leak now, which everybody has with any kind of valve, but there's no evidence of anything else. There's no leakage around any of the points where it was sewn together, any of that. So just I don't want to say a weight lifted off my shoulders, but it was. I walked out of there feeling like, well, I know everything is great. And this picture is probably one of my favorite pictures now, because you can just see what I've seen for so many years, and it's just gone now. And the other big thing that you can see is the aortic root. So that was the ascending aorta right there, and how big that is compared to how much narrower it is now with that prosthetic, which is about half of what it was. So again, this was a great thing this week that happened. And then yesterday I actually went to a new cardiologist, mainly because the current cardiologists I've been seeing, while they've been great and monitoring me for years, and did a good job of sending me at the right time and all those things, they're not a very super responsive office. And even the office visits I have with him, there's not a lot of conversation other than good, bad. There's no real, hey, how do we make this better? What else can I do? And so I went to a new cardiologist yesterday, and explained to him what's been going on. He obviously read through all the medical records that I had sent over. So he had lots of questions when he came in, from, see if I had any kind of cognitive issues, result from being on the pump, which I didn't, which is great. Asked me if we've had our kids checked, since this is a congenital thing, which we have. But again, these are questions he came in asking. He said, hey, I noticed your blood pressure is high, and just looking at some of these numbers, what's going on there? So I explained everything I mentioned earlier here. And his big thing was, okay, let's really watch this, and let me know is if you have a few days in a row where it's over 140 systolic or over 90 on the diastolic, on top number, bottom number there on your blood pressure, because we may need to start you back on benazepril. So I'm on amlodipine now, and I was on both for 20 years, and we're looking like I may want to be back on there, but it's kind of borderline now. So he really wants to watch that, which again, this is I didn't have that level of care because when I went in to get the monitor put on with my current cardiologist, I mentioned my blood pressure there, and I got a phone call from the office just to ask me what blood pressure medicine I was taking. And that was it. I haven't heard anything in a month. I took the monitor off, and it's been almost a month since that monitor's been sent back, and I haven't even heard the results of that. So, again, I can hear that I don't have an irregular beat. I can see being monitored at the rehab that I don't have an irregular beat, but I haven't heard that from my cardiologist. So this new cardiologist said, "Hey, I'm gonna call and get all that information. I'm gonna get all the full results from your echo. So I'll call you and tell you what I'm seeing there." And then just to watch out for that blood pressure, because we want to keep the pressures right, and especially as I'm still only 3 months out. So I'll go back and see him in 3 months in January. But then I asked a couple more questions just because I wanted to know about, hey, what should my max heart rate be? Because I wanted to see if it was going to be, if he would say something different than rehab, and he was exactly saying the same thing. So I explained to him the same thing I've mentioned on here about what I've done exercise-wise. He was very happy to hear that. He said, "But let's keep it there. I like to keep it there with somebody that's had this surgery for about 6 months, and then you should be full go." And so I clarified. I said, "So full go, like everything I was doing before?" And he said, "Yeah, as long as everything tracks the way it is, that's we just want to have 6 months to see that." So that's my plan and what I look at. He said really there's no weight restriction other than he probably wouldn't do more than 30 or 40 pounds, do any kind of bench or chest work just as I'm building that up, because of it all that with an open heart and pulling that apart in the sternum, So that's one of the things I'll pay attention to as I go into my strength training this week. But overall, like, I felt very good with him. I felt like I could have a conversation. He gave me his number, so I can text him if I needed something. So I will be changing that. So a lot happened this week, and a lot of good stuff. So I was kind of why I wanted to wait to do this, but again, this is the 3-month update video. So I'll try to wrap this up, and hopefully this one recorded, but since this is my second go at this. But I mentioned earlier, I feel normal. No pain, no discomfort, just feel normal. I'm not back all the way to what I was doing exercise, but that's just because it's going to take me a little bit to get there, and they want to continue to slowly get so I don't have a setback. Fine with that. But I have so much more energy now. My sleep is good. Appetite's good. I can eat what I want to. Just have to take my blood thinner every day, and everything's been great there. I really want these kind of videos to be encouragement. If you're facing this, if you have a family member and you're just trying to find out what's going on, and 3 months later after having open heart surgery, and you can go back and look at my other videos and see how probably different I look. I mean, I probably have more energy on camera and just feel better and look better than I did before I had the surgery. And so it's amazing how much you can get better in 3 months. So that's my encouragement to you, and it absolutely 100% has made my life better on this side of things, and I can't wait to see as it continues to get better. And so I will continue to make videos, definitely at landmarks if anything big happens. Just again to follow along, because I still look at videos from other folks to see, hey, what does theirs look like, comparing it to mine, because there's it's a huge deal to go through a surgery like this. And so I hope this can be an encouragement. I hope this can give you just a glimpse inside of what somebody else is doing. Please ask questions in the comments. I'm happy to answer anything. But say it again for probably the 15th time that I feel great. I feel normal. 3 months out. I can't wait to see what the 6-month update is going to be. And again, I'll probably update between now and then. So I'll see you in another video, but I appreciate you watching.